Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is left coronary artery. Free medical education. Normally, human heart is supplied by two coronary arteries, right and left. They are vasa vasorum, the small vessels supplying the thick walls of the blood vessels and the heart. The name coronary derives from the Latin word coronarius, means encircling in the manner of a crown. Two coronary arteries arise from the aortic sinuses. What are the aortic sinuses? The aortic sinuses are three small outward dilatations or bulges at the root of the ascending aorta just above the aortic opening. Each sinus is opposite to the respective semilunar cups leaflet of aortic valves. Let's see the diagram. This is arch of aorta. This is ascending aorta. This part is the root of the ascending aorta just above the aortic opening. We have three bulges there called aortic sinuses. If you see the cross section of the aortic sinuses, one sinus is in front, we call anterior aortic sinus. Two sinuses are behind. One is on the right side, called right posterior aortic sinus. Another one is on the left side, called left posterior aortic sinus. We are showing two diagrams in this slide, A and B. Both are seen from above, superior view. In diagram A, this is aortic opening. In front and slightly to its left is pulmonary opening. In the aortic opening, as we have mentioned earlier, we have three aortic sinuses, one anterior, two posterior, right posterior, and left posterior aortic sinuses. We are going to see the same sinuses in diagram B. This is anterior aortic sinus. This is right posterior aortic sinus. This is left posterior aortic sinus. This is right coronary artery. This is left coronary artery. Right coronary artery arises from anterior aortic sinus. Thus, anterior aortic sinus is also known as right coronary sinus. Left coronary artery arises from left posterior aortic sinus. Because of that, left posterior aortic sinus is also known as left coronary sinus. However, no artery arises from the right posterior aortic sinus, RP. No arteries come from there. Because of that, right posterior aortic sinus is known as non-coronary sinus. The coronary arteries which are filled with blood during ventricular diastole, not like other arteries in the body. Grooves, sulci of the heart. Single we call sulcus. The cavity of the heart is divided by internal partitions into four chambers, two atria and two ventricles. Lines of attachments of the partition to the wall of the heart produce the grooves, sulci, on the external surface of the heart. The groove that demarcates two atria from the ventricles is atrioventricular groove. It has anterior and posterior segments. Here, two atria are presented here. Two ventricles are here. The groove which demarcates between the two atria and two ventricles is atrioventricular groove. This is anterior segment of the atrioventricular groove, and this is posterior segment of the atrioventricular groove. The groove that demarcates the two ventricles is interventricular groove. It also has anterior and posterior segments. This is two ventricles. This groove between the two ventricles is interventricular groove. It is anterior segment and this is posterior segment of the interventricular groove. The crus is a point where posterior atrioventricular groove and posterior interventricular groove cross on the inferior, that is diaphragmatic aspect of the heart. This is the point called crus where posterior atrioventricular groove and posterior interventricular groove cross on the posterior aspect, that is diaphragmatic aspect of the heart. This is an important point. This is the schematic diagrams of the heart seen from above, superior view. This is anterior, this is right, this is posterior, this is left sides of the heart. The first thing we are going to show you is this is aortic opening. Above that is your ascending aorta with three sinuses here. Anterior to the aortic opening is right auricular appendage sitting on the right atrium. Anterior and slightly to its left is pulmonary trunk. On its left is left auricular appendage sitting on the left atrium. On the right side of the aortic opening is right atrioventricular opening guarded by three cups, tricuspid valve. Behind the aortic opening is left atrioventricular opening guarded by two cups, bicuspid or mitral valve. Now we are going to talk about left coronary artery. The first is the origin, from where the left coronary artery arises. As you know, we have already mentioned that left coronary artery arises from the left posterior sinus. Left coronary artery runs forwards and to the left between pulmonary trunk and left auricular appendage. Once it reaches to the anterior atrioventricular groove, it divides into two. One, anterior interventricular artery, or also known as left anterior descending artery, and two, circumflex artery. Let's see the diagram. This is anterior view of the heart. This is anterior interventricular groove. This is the apex. This is posterior interventricular groove. This is left anterior atrioventricular groove. Now let's talk about the branches of the left coronary artery. This is the left coronary artery coming out between the pulmonary trunk and left auricle. Once it reaches to the anterior atrioventricular groove, divides into two. The first one is anterior interventricular artery, also known as left anterior descending LAD artery. After it winds around the apex of the heart, it goes up along the posterior atrioventricular artery and anastomoses with right posterior descending artery, which is the branch of the right coronary artery. The circumflex branch. Let's see the two diagrams here. This is the anterior view of the heart and this is the posterior view of the heart. Here is the pulmonary trunk. This is left auricle. This is left ventricle. This is anterior atrioventricular groove. This is left margin of the heart. Now let's talk about the circumflex branch of the left coronary artery. Left coronary artery, after coming out from the left of the pulmonary trunk, that is between the pulmonary trunk and the left auricle, it divides into two branches. We have already mentioned the first one is left anterior descending, and the circumflex is the second branch. The circumflex artery has two segments. The one anterior along the anterior atrioventricular groove is the anterior segment or the first segment. Once it reaches to the left margin of the heart, it turns backwards and runs along the posterior atrioventricular groove, and this is the posterior segment or the second segment. If you see in another diagram, this is the diagram looking the heart from behind. This is back of the left atrium. This is the back of the left ventricle. This is the circumflex artery coming from in front. This is the first part or anterior segment. After coming from here, this is the left border of the heart. It turns around and comes and runs along the posterior atrioventricular groove as posterior or second segment of the circumflex artery. Now, as usual or commonly in 60% of the cases, we have already mentioned in the right coronary artery. This is the right coronary artery coming down. This is the anterior segment. At the right border of the heart, it turns backwards and runs along the posterior atrioventricular groove. Right coronary artery crosses the crus and runs further to the left, and after the crus, this too will anastomose in 60%. That is the posterior segments, the second segments of the circumflex artery will anastomose with the right coronary artery just beyond the left of the crus in 60%. Branches of the left coronary artery. Left coronary artery has two main branches, left anterior descending or LAD and the circumflex branches. There are several variations in the sequences, patterns and distribution of the branches. Left anterior descending artery LAD gives ventricular branches, interventricular septal branches, atrioventricular AV node, and atrioventricular AV bundle branches. The circumflex artery has two segments, anterior and posterior. The anterior segment of the circumflex artery gives sinoatrial nodal branch, anterior left atrial branches, anterior left ventricular branches, diagonal branch, and left marginal branch. The posterior segment of the circumflex artery gives posterior left atrial branch, posterior left ventricular branches, and atrioventricular AV nodal branch. Branches of the left coronary artery. The first main branch is left anterior descending or LAD artery, which comes out from the left coronary artery, descends along the anterior interventricular sulcus, turns around the apex, runs up along the lower part of the posterior interventricular sulcus or groove. The branches given by the left anterior descending arteries very first are ventricular branches. They supply to both right and left anterior surfaces of the ventricles adjacent to the anterior interventricular sulcus. Continuation of branches of the left anterior descending LAD artery. Let's see this diagram again. Here is anterior interventricular groove, and this is interventricular septum, the septum between the right ventricle and left ventricle. LAD is running down along the anterior interventricular groove, and its second branches are interventricular septal branches, that is supplying the anterior 2/3 of the interventricular septum. So LAD is supplying anterior 2/3 of the interventricular septum. The third groups of arteries coming from the LAD are artery to the AV node and AV bundles. From where they comes? They come from first and second interventricular septal branches. So these are the interventricular septal branches coming from the LAD. From first and second interventricular septal branches will supply the AV node and AV bundles also. The circumflex artery has two segments, anterior and posterior segments. Now we are going to talk about the branches coming from the anterior segment of the circumflex artery. They are, number one, sinoatrial nodal branch. This is the one, sinoatrial nodal branch coming from the circumflex artery. And number two is anterior left atrial branches, anterior left atrial branches. Number three, anterior left ventricular branches, anterior left ventricular branches. Number four, anterior left ventricular diagonal branches. And number five is left marginal branch. This is the diagram of the heart seen from behind. This is left atrium, back of the left atrium. This is back of the left ventricle. This is posterior atrioventricular groove. This is the crus. We are going to talk about the second segment or posterior segment of the circumflex artery. This is the anterior segment of the circumflex artery. At the left margin of the heart, it turns backwards and runs along the posterior atrioventricular groove. What are the branches from the posterior or second segments of the circumflex artery? Very first one is posterior left atrial branch. This is the posterior left atrial branch supplying to the back of the left atrium. Next is posterior left ventricular branches. This is the posterior left ventricular branches supplying the back of the left ventricle. The third is atrioventricular AV nodal branches, which is coming from here and supplying to the AV node here at the back of the heart. Structures of the heart supplied by left coronary artery. This is the cross section of the two atria, right atrium and left atrium, cross section of the two ventricles, right ventricle and left ventricle. This is left coronary arteries, and this is branch of the left coronary artery. This is the LAD artery. From the main trunk of the left coronary artery extends to the left and goes around the heart is the circumflex artery. So the parts of the heart supplied by the left coronary arteries are lower part of the infundibulum and the upper part of the right ventricle, entire left atrium, almost entire surface of the left ventricle, almost entire surface of the left ventricle, except a strip on the inferior surface, this is the one, close to the posterior interventricular septum, this part, which is supplied by posterior interventricular artery coming from the right coronary artery. Next is left coronary artery will supply apical region of the heart formed by both ventricles, a strip on the anterior surface of the right ventricle, adjacent to the anterior interventricular groove. This is the part adjacent to the anterior interventricular groove. This little part, the strip of the anterior surface of the right ventricle. They all are supplied by the left coronary artery. Structures of the heart supplied by left coronary artery also includes, in addition to what I have said earlier, they are anterior two-thirds of the interventricular septum. This is interventricular septum. Anterior two-thirds of interventricular septum is supplied by LAD, left anterior descending branch of the left coronary artery. Sinoatrial node in 35%, AV node in 10 to 20%, left half of the AV bundle, left bundle branch LLB, anterolateral papillary muscles of both right and left ventricles, all are supplied by the LAD, left anterior descending branches. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. Please see Anatomy DAHAR series, Coronary Arteries, Apply Anatomy. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.